Cold and flu cases nearly non-existent during the pandemic, but some doctors think we could start to see those numbers grow as COVID-19 restrictions ease. News 2's Katie Augustine spoke with a Lowcountry doctor about cases of cold and flu after a record low last year.
During the current flu season, the Department of Health and Environmental Control has reported 153 cases of the flu. However, during the 2019 season, they reported over 6,700. Dr. Kenneth Perry, a Lowcountry ER doctor, says we could be on the uphill stretch.
We are certainly seeing an increase in patients who have nasal congestion, cough, sneezing.
A common cold, the flu, allergies, or COVID-19. The symptoms overlap. Dr. Perry says knowing what illness a patient has is the hard part.
Flu and COVID are going to give a little bit more body aches, where your upper respiratory infections and things like that are going to be more nasal congestion, maybe a cough.
The CDC says adults typically get 2 to 3 common colds per year, but in 2020, we saw historically low cases of cold and flu nationwide. That's partially because of mask wearing and social distancing, but Dr. Perry thanks to what he calls viral competition.
COVID was just too big of a player. It just pushed all the other viruses out of the way.
The fact that cold and flu cases are on the rise could actually be the light at the end of the tunnel.
It actually, in its own right, is sort of this virology's way of telling us that COVID is starting to make its exit.
In Mount Pleasant, I'm Katie Augustine. Count on